Now, without further ado, it is my pleasure to introduce today's first speaker, David Griga, SVP in our Market Strategy and Understanding Division. David, you have the floor.
Thank you so much, and thanks everybody for joining today. We're excited for this presentation, and I'm joined today by Karen O'Neill and Michelle Drennan from our Ipsos UU Qualitative Division. They'll be sharing with you how we explore the different behaviors that we're seeing having changed in today's environment, and also with Namika Sagara, who leads our Behavioral Science Center, whose team really works to influence the designs, the quantitative and qualitative research designs that we put forward in this area, and really, very importantly, how we look at those insights and activate them through the behavioral science frameworks. So today we're going to walk through a few key areas. First is a recap of the situation and some of the key chief behavioral changes we're seeing and the key trends in the market. Understanding how we learn more specifically about behaviors and drivers of those behaviors with respect to specific brands or product categories, as well as looking to how we activate those in the market. And we'll certainly leave time for any questions and answers at the end of our session today. So we've already seen that COVID-19 has impacted a wide range of behaviors. Chief among them is the role of the home in today's world. The home serving as a new workplace, the home serving as a new school environment, as the chief primary entertainment hub, which influences the types of products people are purchasing, both in terms of durable or electronic or technology that they keep at home, but also the food, drink, and entertainment options that they have. It's also the place where people are connecting more and more with their friends and family, that we have shifted our behaviors from the more social or common environments. So that home becomes a really critical factor in terms of how people are choosing products and how they're interacting with people as well. We're also seeing the changes in travel and outdoor behavior. So we're moving more to more virtual travel or more virtual environments, virtual entertainment. So with less travel, again, we're influencing those behaviors that are impacting our daily routines and habits. And also the idea of how are we choosing products? What's the role of health? What's the role of hygiene and sanitizing products, factoring into a whole new value equation for how brands are selected, products are selected, and categories are being used. So what we're seeing is that many people, and the majority of people, are taking advantage of that increased time at home. They're doing that to explore new things, to try new products, to try new routines, such as cooking routines that they think they would like to continue. And as people have tried new products, such as a streaming service or home deliveries, use of telemedicine, or new contact payments, what we're seeing is that many people have enjoyed those new services, those new things that they've tried. So if they're enjoying that, if it's making their lives more convenient, if they feel safer doing those, then is there a good probability that they might continue to with those behaviors as the pandemic hopefully subsides, as more businesses and governments can open, as we might be able to return to life maybe as it was before COVID. So as those behaviors and cues are giving them a benefit that they didn't experience before, then those might be behaviors that we expect to stick going forward. So with that, I'll turn it over to Karen, who can speak more about her experiences in this area.
Thanks, Dave. So as Dave mentioned earlier, I'm in qualitative, so I'm going to start us off with a story about long-term behavior change. So this is a picture of my great-grandmother Pearl and her identical twin Ruth. They were born in San Francisco in 1903, so they saw some really interesting things in their lifetime, including the 1918 flu pandemic back when they were about 15 years old. Now, they both lived a good long life after that. They lived until the mid to late 90s, so a good 80 years after that pandemic. And as the family story goes, during the pandemic, they lived in San Francisco in an urban area, and the streets really became associated with disease and death at that time. Their mother was a Swedish immigrant, and she ran a very tight ship. And so the family story was anytime one of the children, one of the girls or their brothers or sisters came in the front door, she said, "Wash your hands." So that became a habit, and interestingly, the entire family stayed healthy for the duration of the pandemic. They came to associate that wash your hands when you come in habit with surviving the flu pandemic. So did that habit stay with them? So as I mentioned, they both lived a good 80 years after the pandemic. And every time one of their children, grandchildren, and even great-grandchildren walked in the front door, they said, "Wash your hands." So there's an example of a habit that lasted 80 years. So when we turn our attention back to COVID-19 habits, as Dave said, we've already seen COVID-19 impact behaviors, and we'd like to use an example as we go through the learning approach to understanding these changes and which of them might stick. So the example that I'm going to use today is one that I think we can all relate to, which is cooking more at home. And the people that I'm going to reference are people that we met through our America in Flux longitudinal digital ethnography project, which is a project that we've had going on for several weeks now to understand some of these pandemic changes. So I'm going to talk you through a little bit about some examples of cooking at home that we've observed as part of this research, but it could just as easily be something else, like I think Dave mentioned digital banking and telehealth and other industries that are experiencing changed habits. And we'll try to reference some of those other changed habits as well. But going into this cooking at home example, I'd like to introduce you to some of the people that we met in our America in Flux ethnography project. And the first one is Alfonso. And the important thing to remember about Alfonso is that he's a good cook. And really, he's a great cook. So he grew up cooking. He is of Mexican heritage, and he grew up cooking really complex recipes with fresh ingredients, making everything from scratch. So he really knows his way around the kitchen. But like many of us, he sort of found himself, separating a bit more from the kitchen prior to the pandemic. So COVID-19 and lockdown and all the things associated with that have really brought him back to cooking, which has in turn kind of reconnected him with part of his identity, part of his culture and his roots. And he's also found some side benefits along the way in terms of, health benefits, saving money and things like that. But another interesting benefit specific to Alfonso is seen in this picture here. So Alfonso lives alone, but he has kind of a quarantine buddy or quarantine pod, if you will. I think there are different terms for this, but they're being safe, but they're being safe together. His buddy has a daughter pictured here, and as part of their sort of pandemic behavior, they have been cooking meals together. So Alfonso, remember, lives alone. This has been a really interesting opportunity for him to connect with the next generation, pass down his recipes, pass down some of his heritage, and have that sort of sense of connection. So you can see this quote on the page from Alfonso that kind of exemplifies what we want you to remember about him as we go through this discussion, which is that he is a great cook, and he's such a great cook that even when he eats out now, he realizes he could have made it better at home. So that's what to remember about Alfonso, and we'll come back to him as we talk about which changes are going to stick. But next, I'd like to introduce you to another one of our America in Flux respondents, who's Regina. Regina is retired and has cancer. She's immunocompromised. Prior to the pandemic, she had been participating in restaurant meetup groups as a key part of her social life, and she would tell us that she really misses that camaraderie. But of course, being immunocompromised, she feels that eating out is not worth the health risk. So when you look at this quote from Regina, in contrast to Alfonso, her attitude about cooking is really more about resignation. She is cooking at home out of necessity because she cannot go out to eat. If she could go out to eat, she would. So that's a very different perspective. And then the third and final perspective I'll share is Bill. So Bill, what I want you to remember about him is that he's a creative person. He is a photographer by trade and training. So he uses cooking as a creative outlet and a challenge. And being a photographer with a little less work right now, it also helps give some structure to his day. And it gives him a way to bond with his teenage daughter, who's also at home quite a bit. And as you'll see on the next slide here, it gives him a way to meet his health goals. So if you look at the quote on this page from Bill, it's about saving money, yes, diet and exercise. He says, I'm going to put together this $15 dinner for three. And he starts talking about this sort of fad and healthy eating things that he's tried. He's actually lost weight during the pandemic. I think Bill is probably the only person who's lost weight during the pandemic. So yay for Bill. But interestingly, as I talked to our researchers about Bill and about this clip, they said, you know, for him, it's really not about money savings or about health. It's really about using his kind of creative skills to solve this challenge of what am I going to do with the money I have and the ingredients I have to make the very best, most appealing meal that I can. In this case, he's making salmon cakes, which looked really delicious. You may have seen them a couple of slides ago. So that's Bill. And what I want you to remember about Bill, again, is that he's a creative person. So we just talked about three people. All of them are cooking at home more often. All of them are cooking at home for very different reasons with very different motivations and different needs and emotions associated with that. So the question is, which of these behaviors will stick? So next we're going to go into a learning approach to answer that very question. So we'll talk about what behaviors are changing and to what extent they're changing. What are some of the motivations behind those behavior changes? We'll talk about how to analyze which changes may actually stick, and then most importantly, how to equip your brand to succeed and what your brand can do as the world changes. So with that, I'm going to turn it over to Namika, who's going to talk a bit about the research approach.
All right, thank you, Karen. Hi, this is Namika. I'm a behavioral scientist and president of Behavioral Science Center. So for the next few minutes, I'll talk about research approach, which will also give you an example towards the end, so how this all comes together. So in terms of research approach, let me introduce this Ipsos behavioral evolutions. So we take this very holistic approach that started with macro trend, understanding the macro trend, including socioeconomic trend, which took a quite a bit of a turn since COVID-19. We also look at micro behavior as well. What are the motivations and functional emotional needs that are underlying those behaviors? And what are the frustration and challenges that becomes the barrier that make it more difficult to make the behavior happen and also make the behavior more sticky? And we learn all these different aspects through the lens of behavioral science in order to have a deeper understanding of behavior drivers, but really particularly on the motivation and the behavior triggers and the barriers and the rewards, many different components to make the behavior sticky. So in order to do this, we'll take a multi-step approach. We will kick it off with curation. In curation, we really focus on macro trend, such as socioeconomic trend, but we use QUAL to deep dive in core motivation, functional and emotional needs as well, and also the challenges they face in the context that consumers are in. And that is followed up with a quantitative study. That is to quantify and validate new routines, new behaviors, and new challenges. And we'll go through this more in details in a few minutes. But one unique aspect of this approach is that behavioral science is integrated throughout, from the discussion design to analysis to activation. With that, let me introduce our behavioral science framework we use throughout this research. So this is the Ipsos behavioral science habits framework. has three main components. One is Q. So Q is, you can think of as trigger, something that trigger behaviors to happen that is obviously motivated by some type of motivation. And the trigger can have many different factors. For example, it could be locational settings. It could be that it's weekend. Let's find something to do at home with your kids. Or perhaps these days, maybe just being in a COVID environment, you may think of cooking at home like our participants did. Also, script is something, for example, people like to end their meals with something sweet, something caffeinated, which might trigger you to think about making dessert from scratch. And we have identities and roles and psychological states. One of the most powerful psychological trigger that we might tend not to think about is boredom, which perhaps some of us might be experiencing more than when the time that we were able to go out. The boredom actually can be triggered to look for something fun to do, or for participants like Bill to challenge himself to cook 3 serving meals for under $15. Physical states can be a trigger as well. We saw in the case of Regina, she has a cancer and she is immunocompromised. So it is a trigger for her to cook at home instead of going out. Even if there's a motivation and trigger, if there is a significant behavior barrier, the behavior is less likely to happen. And again, just like with cues, there's multiple factors that can serve as barriers. One is the physical and ability barriers. Obviously, if people are not physically or ability to do certain behavior, that's likely to happen. Or it could be the emotional barrier. In the case of home cooking, maybe you don't feel like you're a great cook, or you fear that you might mess it up. It could be the multiverse. Maybe you don't know how to make pasta from scratch. Or you might think it takes a lot of effort, so you won't even try it. Or the financial barriers. Although cooking at home tend to save you money, it might associate with startup costs. For example, Regina bought an air fryer for her to cook. So there was one-time startup cost. Third component is reward. Just like cues and behavior, there's a multiple factor that can serve as reward. I think one obvious one is the functional reward. But there's also social rewards, such as the participant's Alfonso. The rewards for him is this bonding time with his roommate and his roommate's daughter. There's emotion rewards of sense of accomplishment. Or in case of Regina, enjoy using her air fryer. Cognitive rewards, perhaps somebody like Bill, it's a challenge. It's an interesting challenge for Bill to come up with how to use only $15 to cook 3 serving meals. So I hope I gave you some introduction into Ipsos habits framework and walk you through or give you an example how you can use this cues, behavior barrier, and reward to understand how behavior can happen and to predict which behavior is likely to stick. Michelle?
Thank you, Namaka. This is Michelle Gabi-Drennan, Qualitative Strategist at Ipsos. And as Namaka mentioned a minute ago, the first step to determine which pandemic behaviors will stick is to identify trends as well as current knowledge gaps via curation. Now, this step is strongly recommended because regardless of what data you have available, we need to identify those possible future scenarios that are key to understanding future behavior. Or even if you have analogous data already available, you may not be looking at it through a behavioral science lens. Thus, Ipsos recommends starting with a knowledge audit, understanding what you do have available to you. From there, we move to creating a framework and meta-analysis. Here we look at socioeconomic impact and trends and begin formulating possible future scenarios, all of which is fueled by a range of readily available sources, both internal to you and secondary. The goal of this step is to identify possible narratives for and insights into future behavior, as well as develop hypotheses to take into the qualitative research. The final step is to pull together the curation via storytelling. If we think through the three parts of any good story, we want to be able to identify the setup and tension, and to think through what the resolution may look like, all with your brand being the hero. At this point, we should have a solid foundation as well as a slew of theories. After curation, we move to the exploratory QUAL, and today that's typically being executed via virtual one-on-ones or a digital ethnography. Now, there are three core areas that the QUAL needs to hit upon: motivation, needs, and behavior. We want to start with understanding the respondent's context. What are their underlying human motivations? Now, there are several approaches that can be leveraged here, but we recommend Syncytium. Syncytium is Ipsos's framework to understand motivations, aka the fundamental human desires that drive our behavior. Some companies call them need states, others call them emotional drivers, but it boils down to the same thing: putting the why before the what to understand and explain the relationship consumers have with brands. Ipsos's Syncytium is a globally validated approach, one that we like to think of as a compass, which guides you around the world of human motivations. During this portion of the interview, you should expect projective exercises to help respondents say the unsayable and articulate emotions and drivers that they may not be able to put into words. Once we understand a consumer's motivations, we turn to their needs. Within a specific category or service use, it's essential to understand a respondent's needs or desires, though we're not likely to use those exact words with them. Rather, we leverage storytelling or show and tell to understand all the minutiae about the last time a respondent bought, used, or did something. We will use, say, storytelling to identify all the cues that led to a behavior, as well as the rewards that reinforce that behavior. We'll also uncover all the anti-cues that lead away from a behavior and the anti-rewards that dissuade that behavior again. With all of those cues, anti-cues, rewards, anti-rewards, we seek to understand which of them will exist in the future state. Also, while storytelling, we will leverage the opportunity to ladder, building up to identify higher order needs and benefits. And of course, we're going to explore any hypotheses or theories that came out of the curation phase. The last step in the qualitative phase is mapping behavior, cues, and rewards to the Ipsos habits framework, while aligning on which elements are likely to continue into the future beyond this current COVID-19 disruption. Now, this is a great time to emphasize that Ipsos behavioral evolutions can be leveraged for any behavioral disruption, not just COVID-19. As the QUAL phase begins to wrap, the quantitative phase of this approach begins to gear up. Dave?
Thank you. Yes, as we move into the quantitative phase, one key area is to understand how prevalent are the changes that were uncovered through the extensive qualitative exploration. So to do that, we use a very engaging, focused 10-minute survey that can be completed equally as well via a PC or a mobile phone or any choice that the respondent chooses to engage with us. So the first part is decidedly to quantify how many people experience each behavior change, and then explore more as to why. So if people are cooking at home more, we want to quantify what are the reasons behind that. And to help us in the quant phase, we use visual-led motivations for that. This exercise is really engaging for the respondents, and it captures information in a more detailed, emotional way than if we didn't use the visuals leading the exercise. The way that works is we would ask people, what are they looking for in this category? What are they looking for these products, or when they're engaging in a certain type of behavior? They scroll through a list of images that are designed to represent different syncytial motivations, and they pick the first 5 that they think relate to the situation, the context we're asking about. And the first 5 is very important because we want this to be a tap really into their more system 1 type of decision-making process. So we don't want them screening through the images directly, because we care more about what they tell us in the next question, which is, what do those images mean to you in this context? What do those represent? And it's their free-form verbatim responses that we use in our analysis using some advanced text analytics to then break out the key themes and sub-themes that describe these motivations. And that's all quantifiable through the text analytic platform. So now that we know what behavior is changing and why it's changing, the next part is understanding what unmet needs or frustrations or challenges still exist. To capture that, we use a similar style of questioning using visual metaphors before capturing their verbatim responses. But in this set, it's a unique set of images from the first one, and the images in this sense are more, I would say, have more of a negative connotation, right? They might be somebody looking at their watch indicating time pressure, or being shackled down by chain indicating some sort of weight or anxiety in their daily lives. So by understanding those key motivations and frustrations in this way, we can tap into a more emotive sense of reactions. I think also what we find is when we use these visual images to prompt the question, we get 6 times as much response back. So the number of words they're playing back to us, the number of themes and connections they're making, gives us a much richer, deeper analysis. So I'll spend some time now talking about how this comes together. How do we take the trends that we're seeing in the world today, the behaviors that we're seeing that are changing from the QUAL and the QUANT perspective, and lead that into activation? So if we think back to Alfonso, who we met earlier, so he's cooking at home more, and it's really for, in a motivational perspective, a sense of control. But he's doing this for a few socioeconomic reasons, right? He's being impacted by concerns on financial concerns, by health concerns, and following social distancing regulations. And because what he's seeing in the news or the world, he thinks that the recovery will take some time. He doesn't expect a quick return to pre-COVID life. He's also looking at this in a sense of, what's he looking for from this time? Well, he still wants some functional benefits. He's looking for healthy and tasty and quality meals, and he's looking to save money. But he also has a very deep emotional need. He wants to connect with his family heritage. He wants to connect with his friends and next generation and pass along those traditions. And it gives him a real sense of accomplishment by being able to do this and share that with the people close around him. So those trends and these needs leads to behaviors that allows them to cook more and to cook more complex dishes. So the question becomes, for Alfonso and for other people like Alfonso, would this behavior continue even after COVID and social distancing guidelines ease? So we think there's some cues that will enable this. So one is there a time of day or is there a social cue as to say, can he do this when his friend and his daughters arrive? So those are things that might be a little bit more neutral, because maybe he has some a different working lifestyle post-COVID, or his friends and family may also go and see, may not be around as frequently. But there aren't any behavioral barriers. He has the ability to do this. He has the ingredients. He has the supplies on hand generally. So there isn't a behavioral barrier that would prevent him from continuing continue cooking at home. And the rewards are really more positive. There's no negative association to this. So he gets better quality food than the restaurants in his perception. He builds those in personal connections, and he can build the connections to his community, his heritage, and he has that sense of accomplishment. So when we pull all that together, we can make an assessment. Will the cooking at home continue for Alfonso? We would think it's very likely, highly likely that this would continue, because the barriers are very low for him. but the rewards are high, both from functional and really, really importantly, that emotional connection, that emotional reward. But as we saw earlier, people who are cooking at home more now than they had before aren't all in the same boat as Alfonso. So Regina, who's pictured in the middle, she's health compromised, so she's cooking at home really because she has to, just for her safety. So whenever it's time, whenever she feels it's safe to go back to restaurants and go back to meeting her friends and family in those places that she enjoys, she will likely quickly go back to those behaviors once the health situation she feels would be safe for her. On the other hand, we have Bill on the right, who has kind of a mix of motivations and behaviors in this area that may make it so with him, he will likely continue to create routines in some of it and keep some of these new routines, right? So he is liking losing weight, he is liking controlling the message of healthier eating, but he does miss some of the previous routines. So he will have a mix of that. So you can see different people, all with the same behavior, increased cooking at home post-COVID, then the likelihood to continue will be different based on those specific behaviors, motivations, and frustrations associated with it. So with that, I'll pass it back to Michelle for another example.
Perfect. Thank you, Dave. Our final example is a marriage of the healthcare and tech sectors. So from Ipsos Marcom's data, we know that 61% of those consumers who are using telemedicine websites or apps expect to continue using them. And this patient-oriented view is validated by the Ipsos healthcare surveillance data with healthcare professionals. At the time of field, physicians said they were seeing roughly half as many patients per week as before COVID-19, and that practices were changing with the sudden and broad adoption of telemedicine. So from the patient or the consumer lens, we can hypothesize that control and security are core motivations driving the uptick in telemedicine. We know that mental and physical health are being impacted during this time. When it comes to needs, we also know that chronic health conditions still require follow-up regardless of COVID-19, and acute health situations arise, again, regardless of COVID-19. Patients need to feel safe when seeking medical attention and not that they're endangering their health more by going into a physician's office. The coupling of these motivations and needs leads to telehealth, particularly for healthcare that does not require an in-person visit. While certain health conditions, like pregnancy, may still require in-person visits, patients are using and exploring online health options for other conditions, from prescription-based therapy to therapy itself. So, will telehealth continue in the future? If we look at the cues, behavior, and rewards, we see sustainable cues and rewards with possibly fewer behavioral barriers. The impetus for virtual care already existed before the COVID-19 pandemic. Implementation was originally gradual due to a lack of infrastructure, a lack of experience, a lack of understanding of benefits, and ultimately, before COVID-19, there was no major incentive to change. Post-COVID-19, we believe that telehealth will become a mainstream feature of medical practice and allow connected health and digital therapeutics to rise in importance, understanding, and acceptance. Barriers are low, there are newly discovered sustainable rewards, and ultimately, it's likely to continue. Now, once we have identified insights, such as this one, you may be wondering how to roll them out in your organization and ensure that actions are taken. Namaka?
Thanks, Michelle. So after we are done with the research, we use behavioral science to activate on the insights. To do that, first, we can immerse you and your team in research findings. Then identify the likelihood of your targeted behavior, either that is cooking in the home or using telemedicine. But those targeted behaviors stick in by consolidating the macro trend and consumer motivation and needs. And what are the cues? What are the behavior barriers? And what are the rewards? And based on all these, where are the areas you can make the most impact on? For example, one possible avenue might be to pursue to create a more sustainable cues or address certain behavior barriers, such as emotional barriers. Or if you think the rewards is a challenge to create more sticky behaviors, then you can think about how to create more immediate and multifaceted rewards that has a multiple component of rewards. So throughout this workshop, you'll have opportunity to apply behavioral science through very hands-on exercise, as well as co-ideation session on what you might be able to do to bring the insights into life with a team of PhD behavioral scientists. So to recap, we discussed this holistic research approach to have a deeper understanding of what behaviors, how the behavior has changed and which one is likely to stick. We believe that the best approach is also a holistic one. So we have curation that really gets to this macro level trend, including socioeconomic trend. And we also discuss qualitative, which is to deep dive in core motivation and functional and emotion rewards, as well as the challenges they face in the customers, the context that customers in. And Dave talked about quantitative to validate new routines, behavior, and challenges. And finally, we discuss workshop to transfer the insights into strategies. So I hope this webinar has been helpful for you. I think we have a few minutes for questions. Dave, do you know we have any questions?
Yeah, a couple of questions that have come in. The first one is, to a degree, Syncytium looks like another segmentation tool, but we already have a segmentation for our organization. Will that be relevant to us? So I think, Michelle, do you want to address that question?
Absolutely. So I think it depends on the nature of your segmentation. So oftentimes segmentations are focused on a behavior or attitudes, and they may not necessarily have a motivational component, let alone a motivational component in today's day and age and current environment. So I think what I would recommend is that Syncytium can add an additional layer on top of your segmentation. And you saw that with many of our examples today. Syncytium was actually added on to other factors.
Okay, thank you. Well, another question. I work in consumer banking. Can you give me an idea of what kind of changes might stick as it pertains to banking? Karen, can you address that question?
Sure. Let me start us off with what we've seen in our America in Flux project as we've been following some of the changes that have been happening. So consumer banking, definitely seeing some changes in that area, primarily as it pertains to people adopting digital solutions. So we're seeing much broader adoption of digital banking, or I shouldn't say much, as qualitative, but you get the idea. We're seeing people adopting services that perhaps they hadn't been adopting before, as well as things like budgeting apps. So definitely seeing some of that. In terms of what will stick, maybe Namika, you could talk about that aspect of it.
Yeah, so it really depends on cues and behaviors and rewards. So if you think about cues for using a digital app for the first time, that could be emotional cues of, I'm afraid of going outside and do something in person. So that could be cues. But those cues might disappear once the COVID situation is handled. However, if you think about different cues, cue can be transferred into something more sustainable. So Q could be that's just what we do. It's like it becomes a social norm for some. I think certain consumer groups, it's almost a norm to use digital banking. So that could be a sustainable cues. In terms of behavior barriers, what I've seen so far is the biggest behavioral barriers for using a digital banking system, for example, or digital app, for the first time is knowledge and effort. People don't know how to use the app. People think it's really complicated. It takes a lot of effort. And there's an emotional barrier. what if I mess it up? What if I lose all that money I tried to transfer to my friends? But once you start using, those barriers will go down. The knowledge won't be a barrier, effort won't be a barrier, it actually becomes a reward, right? Because it's so easy. And the emotional barrier is likely to go down. And I think positive reward is, the convenience, the time that you save. Instead of doing your chores, you actually spend time with your friends and family. So my speculation that it will increase adoption and it will likely to last.
Thanks, Namika. Dave, do we have any other questions?
These are the questions I see for today. So I want to thank everybody for attending today, and please reach out to us if you have any follow-up or questions. Thank you again for your time.
Thank you, David and Karen, Michelle, and Namika for today's really interesting presentation about these behaviors. And thank you, everyone, for joining us today. If we didn't get to your question, then we will do so by email. And you will also receive an email with a direct link to today's recorded presentation. Of course, we welcome the opportunity to speak with you, so please do reach out to us. That now concludes today's webinar. Have a wonderful day.
Thank you.